Welcome. Today we're diving into a rare but serious lung disease, chronic thromboembolic pulmonary hypertension, or CTEPH. This condition affects the arteries in the lungs, leading to increased blood pressure and placing a strain on the heart. Join us as we explore what causes CTEPH, how it impacts the body, and what can be done to manage this complex disease. What exactly causes CTEPH? It's triggered by old blood clots, pulmonary emboli, that have traveled to the lungs and have not completely dissolved. Over time, these unresolved clots organize and scar, blocking or narrowing the pulmonary arteries. While deep vein thrombosis and pulmonary embolism are risk factors, not everyone who experiences a pulmonary embolism will develop CTEPH. In some cases, the initial pulmonary embolism may even be silent, going unnoticed. There are also other conditions that are believed to increase the risk, such as certain blood clotting disorders, autoimmune diseases, infections, and having a history of splenectomy. Now, let's delve into the pathophysiology. CTEPH fundamentally alters the normal flow of blood through the lungs. The persistent blockages from the organized blood clots cause increased resistance in the pulmonary arteries. To compensate, the right side of the heart, responsible for pumping blood to the lungs, must work harder. This increased workload leads to right ventricular hypertrophy, meaning the muscle thickens. Over time, the right ventricle may fail, leading to right-sided heart failure. Furthermore, the reduced blood flow to the lungs impairs gas exchange, resulting in lower oxygen levels in the blood and contributing to shortness of breath and fatigue. CTEPH is considered a rare disease, but its exact prevalence is difficult to determine. It is estimated that a small percentage of people who experience a pulmonary embolism will develop CTEPH, with estimates ranging from 0% to 5%. Diagnosis can be challenging, leading to underdiagnosis. CTEPH can affect people of all ages, though it is more commonly diagnosed in adults. It's important to note that improved awareness and diagnostic techniques are helping to identify more cases. The signs and symptoms of CTEPH can be subtle at first and often mimic other lung or heart conditions, making early diagnosis challenging. The most common symptom is shortness of breath, especially during exertion. Other symptoms include fatigue, chest pain, dizziness or lightheadedness, swelling in the ankles and legs, and a persistent cough. As the condition progresses, symptoms become more severe and can significantly impact daily life. If you experience these symptoms, especially after a history of pulmonary embolism, it's crucial to consult with a healthcare professional. Diagnosing CTEPH involves a combination of tests and assessments. Initially, a doctor will perform a physical exam and review your medical history. An echocardiogram is often used to assess the function of the heart and estimate pulmonary artery pressure. A ventilation perfusion scan, or VQ scan, is crucial to identify areas of the lung where blood flow is blocked or reduced. Pulmonary angiography, considered the gold standard for diagnosis, involves injecting a contrast dye into the pulmonary arteries and taking X-ray images to visualize any blockages or abnormalities. Additionally, blood tests may be ordered to rule out other conditions and assess overall health. While there aren't distinct types of CTEPH in the same way as some other diseases, CTEPH is classified based on the location and extent of the clots in the pulmonary arteries, which is important for determining treatment options. Some patients may have blockages in the main pulmonary arteries, while others may have more distal, or smaller, vessel involvement. Additionally, some patients may have comorbid conditions like small vessel disease that affect how CTEPH is classified and treated. Treatment for CTEPH aims to improve blood flow to the lungs and reduce the strain on the heart. The primary treatment is pulmonary thromboenderectomy, or PTE, a complex surgical procedure that involves removing the blood clots and scar tissue from the pulmonary arteries. PTE can significantly improve symptoms and prolong life in eligible patients. For patients who are not candidates for surgery, or who have persistent pulmonary hypertension after surgery, medical therapy can be used. This includes medications called pulmonary vasodilators, which help to relax and widen the pulmonary arteries, reducing pulmonary artery pressure. Balloon pulmonary angioplasty, or BPA, is another treatment option where balloons are used to dilate the narrowed pulmonary arteries. Management also includes supportive care, such as oxygen therapy and diuretics to manage fluid retention. Unfortunately, there are no definitive ways to completely prevent CTEPH. However, managing risk factors for pulmonary embolism, such as obesity, prolonged immobility, and certain medical conditions, can help. Prompt diagnosis and treatment of deep vein thrombosis and pulmonary embolism are crucial to reduce the risk of clot organization and CTEPH development. In high-risk individuals, anticoagulant therapy, or blood thinners, may be considered. The prognosis for CTEPH varies depending on the severity of the disease, the effectiveness of treatment, and the presence of other health conditions. Without treatment, CTEPH can lead to progressive heart failure and death. However, with appropriate treatment, including PTE surgery and medical therapy, many patients experience significant improvement in symptoms and survival. Ongoing research is focused on developing new and improved treatments for CTEPH, including novel medications and minimally invasive procedures. Researchers are also working to better understand the underlying mechanisms of CTEPH and identify individuals at higher risk of developing the disease. Early diagnosis and treatment are essential for improving outcomes in patients with CTEPH. If you suspect you may have CTEPH, talk to your doctor about getting evaluated.